Welcome. We've been doing a series of conversations about what's next in the workplace. Most of that has been because of COVID-19 and the challenges that we have getting back to work. I'm excited to be here with Rex Miller and Dr. Jeff Jernigan. They have been studying this COVID crisis and the impact that it has on the workplace and have just written a book, Return to Work, A Leader's Guide to Avoiding the Mental Health Crisis. And we're going to be doing a three-part series of this, looking at the different aspects of getting people back into the workplace. Welcome to both of you. I'm looking forward to this conversation today.
Bob, it's good to be with you again.
Thanks for having us, Bob. It's good to see both of you.
Dr. Jeff Jernigan is a board-certified mental health professional known for influencing change in people and organizations by taking them to new heights through greater resilience and workplace mental health innovation. More than 25 years serving in leadership roles as CEO, COO, and CHRO in life science and healthcare industries provides a solid foundation for his work as a clinical professional. A lifetime focus on humanitarian aid is reflected in Jeff's service as the Chief Executive Officer and co-founder with his wife, Nancy, for the Hidden Value Group, an organization bringing healing, health, and hope to the world through healthcare, education, and leadership development. Jeff, it's great to have you here today.
Thank you, Bob. Thank you for having me. It's great to be with you.
And Rex Miller. Rex leads Mindshift, a futures research and consulting firm that specializes in solving complex business challenges in the AEC industry. He works at the intersection of numerous complex challenges, including the common nightmare of delivering capital projects, workplace disengagement, toxic shadow cultures, workplace health, and well-being. Rex has written numerous books, including The Commercial Real Estate Revolution, 9 Transforming Keys to Lowering Cost, Cutting Waste and Driving Change in a Broken Industry, Change Your Space, Change Your Culture, The Healthy Workplace Nudge, and his latest book, Whole. Rex has developed numerous successful high-performing teams. Project managers who go through his program gain the framework to deeply understand their own strengths and the strengths of others. This knowledge unlocks the hidden genius factor in every team member and turns them into a supercharged team. Rex has won the Cornet Global Innovator Award, Industry Excellence Award, and IFMA's Award for Excellence. We have 3 discussions with Rex Miller and Dr. Jeff Jernigan, addressing how leaders can avoid a mental health crisis as we attempt to find a new normal for work. The webinars are going to be about why COVID needs to be handled like a mass disaster recovery. The second one is going to be the unique challenges and brain health support needed for work from home. And the third one will be about how companies can prepare managers for the new demands supporting employee mental health. So we're going to start today with looking at COVID and why this needs to be handled like a mass disaster recovery. Rex, let me start out with you. Why don't you tell us about what the workbook is and who the workbook is for?
Well, the workbook is really a guide to some of the new challenges that we face because of COVID. What I saw taking place is that our industry was doing a great job preparing people for the physical safety of people coming back to work. But as I was coaching and talking to Jeff on the people he was coaching, we were finding a lot of concern about mental health, chronic stress fatigue, and nobody was really producing anything on that. So we partnered together and we built a workbook to help prepare companies for what's coming and also to help prepare them to how to manage through this process. So it's really meant for leaders and managers in this new kind of work world that we're in.
Let me ask you, why mental health?
Well, because it's the elephant in the room. All of the things that are happening are physical that we see and that we're addressing. But what we're not addressing is the impact on people and the emotional impact. When I coach, I'm seeing people break down in front of me. And a lot of times managers don't see that side of their employees. And plus, we're now distributed. We're not physically with each other. So we're not picking up on these clues. What Dr. Jernigan brings to this table is understanding what's really going on behind it. So I reached out to really try to understand what is happening and to what scale. So that led us to really talk about and frame this in terms of a mass disaster recovery event, as opposed to just a change management effort, which most of us are dealing with.
Can you give us an example of what some of the topics are that you cover?
Well, first of all, we're framing it as a mass disaster recovery and the different stages. And so Jeff will go through those stages with us. We're also looking at the 5 stages of grief. Everybody is in one stage or another of those 5 stages, and we need a means to be able to deal with that. We're also looking at manager preparation. This has really exposed kind of the really naturally good managers and those who are what we call the caretakers or babysitters. And the babysitters or caretakers, which is most of the managers, Gallup says 80% of managers are in that category, are simply not equipped to know how to handle the new needs of people coming into the workplace. And then we've talked about, and we're dealing with the remote work in the book as well, and the mental health strain. And then we're providing some tools and assessments as well. So that's a quick overview.
Maybe if I can ask how you work together and the different roles that each of you play in putting this information together.
Well, I met Jeff when we were doing research on education, and we were looking at the challenge of burnout for educators. And his practice specializes in burnout, PTSD, chronic stress, and helping people move in that direction. We actually met at a health and wellness conference called WellCOA a couple of years ago. We were introduced through a common colleague. We started talking, and I found that he was a tremendous resource and somebody I needed to be able to go to more deeply understand these issues.
And Jeff, why is COVID like a mass disaster?
Well, I'll give you 3 reasons, Bob. First of all, it's global. It's not just limited to a city or a neighborhood, a town, or a state. It is all across every country around the world. Secondly, it involves trauma. The impact of this disease has created fear and anxiety, which is unrelenting. People are concerned about their job security with everything closed down. They have perhaps been traumatized by the illness and perhaps even death of friends, family, colleagues, loved ones. They have been impacted by even the trauma, if they haven't experienced, that they experience vicariously by watching others go through this, dealing with the loss, dealing with grief. Back of their mind, realizing I could be next, and what's going to help prevent that. The third reason is because it follows a pattern. We've been studying mass disaster and violence globally for the last 30 years, and we know that there is a pattern that comes out of this. SAMHSA, the government's mental health organization, has a great illustration, which Rex has done a wonderful job of adapting for this workbook. But what we recognize is it doesn't matter where in this globe a mass disaster takes place. People respond to it the same way, regardless of culture, socioeconomic status, language. There are no differences, and they respond the same in the 1st through the 4th generations as stress and trauma become a legacy that's passed on from one generation to the other.
Now, you've described a little bit about what people are experiencing. What are some of the things that we're not seeing as we go through this?
I think one of the things that's very difficult to recognize, partly because of our assumptions and partly because most of us have not been through mass disaster of this nature before, there is an alienation that occurs in people that are subject to prolonged stress without relief. And it's an alienation characterized by an indifferent hostility without objectivity. people acting out in their homes, acting out in the workplace, acting out in the grocery store, way out of proportion to whatever triggered that episode for them. It's an anger that's expressed without focus. It's an indifferent hostility. And the manner in which they act out, screaming at one another, throwing things, sabotaging work in the workplace, threatening harm to self or to others, it appears to be without any objectivity at all. There's no specific target, there's no specific reason, but everyone that's around that person when they explode is victimized.
You know, we're in a really unique situation here where we have a coronavirus, we have an economic depression. In California, we've got wildfires, we've got systemic racism. I imagine there are people who are suffering through multiple situations like this. What are some of the early signs that people should look for in the workplace to try to help alleviate some of these problems?
Well, some of the earliest signs are easy to miss until they become pattern. People not thinking rationally, not responding with control, having trouble regulating their emotions. If it goes beyond that, you'll hear people expressing and acting out fear and anxiety, skepticism, distrust, perhaps a little paranoia, anger, hostility. When you see those surfacing among a large number of people, or you see those things surfacing in people you know well and that those behaviors are uncharacteristic for them, those are the early warning signs.
What are some of the things that people can do to help try to minimize, reduce that risk?
Well, let's start with the workplace at large. Employers are having to change strategies now, business plans, based on the impact of the pandemic and these other factors, the remote work, the in-person work, what's going to shift and change. And whenever you change your strategy, you need to make sure you realign the workplace culture with that strategy, because if you don't, culture will eat strategy for breakfast. And that mismatch creates unnecessary tension and stress in the workplace until there is realignment and things are working smoothly again. So employers can create a workplace environment that doesn't add stress to the people that are coming back with stress already. It's not like we've all been on a 4-month vacation, we're coming back rested. We're adding stress to the equation by coming back to the workplace or remaining remote as workers when we thought that relief was just around the corner. Now, individuals coming back can help manage their stress. They can shed it, they can de-escalate, they can self-regulate, and it's going to be a function of their nutrition, their sleep, their exercise, and their relationships. Those are the 4 horsemen of stress management. We need to realize that stress is a part of life that's normal and healthy until it gets unmanageable, until it's the wrong kind of stress, bad stress. And if it goes on being unmanaged, it can become a medical condition and actually morph into a disease that needs medical and mental health intervention. We don't want that to happen. We want people equipped to handle stress in their lives and stress in their workplace effectively, so stress becomes more of a normal wax and wane of life in the workplace and not a medical condition, a disease.
And Bob, if I can, I'd like to direct a question to Jeff. One is the broken trust that people have coming back. 2, and I'm finding this in interviews, is that a lot of people are waiting time to find other opportunities as well. So there are some real risks to companies thinking that, we're going to take care of you, trust us. I don't think that's really going to be how it plays out for a lot of companies. So Jeff, if you can address that to some degree, that broken trust and what's going on in clients' minds about if they didn't have a smooth transition to work from home, they might be looking for another place to work.
Yes, the social contract between the employer and the employee has been broken. We consciously and unconsciously as employees look to the employer to take care of us, to protect us, both in the workplace and in terms of our job security and our financial security. And that has been absolutely shattered. And it doesn't matter who is responsible or what is responsible. We experience it as a break in trust. That's also true about the social contract between the government and the workforce and the population. They're also an institution that we look to consciously and unconsciously to protect us, and they have failed miserably. So now we have this sense of broken trust, which develops into skepticism, safe decisions, not necessarily decisions that lean into solutions, but decisions that are more self-protective. We have an insecurity coming back to work. Am I going to be furloughed? Am I going to be laid off? Is the company going to downsize? All the fear and anxiety around those issues that flow out of and are not helped by the broken trust in the institutions that used to take care of us in that regard, gave us some confidence and security about our future. That's all building up now. And I, like you, Rex, have talked to a lot of people, line staff, managers, executives, that even though they love their job and they're grateful they have work, or it looks like they're going to be going back to work, are looking to change and even move from one industry to the next based on the perception of that industry being more resilient and disaster-proof than the one they're in now. Healthcare, for example, has got more unsolicited applicants for any job possible ever, because another disaster like this is going to impact healthcare in terms of employment security less than if you're an Uber driver, for example.
You know, as you guys look at this, over the next 6 to 12 months, what are some of the things that you expect to start happening?
Well, positively, we're adapting. There may be a vaccine, but also we're running to the end of the government subsidies. And even if you get a deferment from rent, you're still going to have to come up with those payments at some point in time. So we really haven't seen the full impact, the economic impact, that as they begin to turn off the spigot, we're going to start seeing more layoffs. We're going to start seeing more people evicted from their houses. And so that's a big unknown on how that's going to ripple through the economy. I personally feel that one of the areas that we've overlooked is what's happening to our kids in education. And we haven't seen that ripple effect yet, but missing a vital part of learning, especially if you're in that early childhood and learning the social skills. Once you get to first grade, it shifts to academics. And so those social skills are lost, will show up when they graduate when they're 18. So we've got 20 to 30 million kids that are going to miss that. We've got a third grade window of reading that's vital. And if kids don't hit that third grade window, we know that kids that cannot read at a third grade level are 60% more likely to drop out before the end of high school. Now, we won't see those impacts until years from now, but that's some of what the work that Jeff and I are doing, is looking at some of the unintended costs that are coming, the deaths of despair that Jeff can certainly speak to better than I can, that we're starting to see. So leaders, what I feel like now that we're starting to see some of these reveal themselves, leaders are going to have to look at this from a far more holistic standpoint of balancing not only the epidemiology, the virus, but with the economic impact. So we need economists in this conversation. We need mental health people in this conversation, and we need educators. Together, I don't think we can really navigate this properly without a well-balanced conversation and having to make some really hard choices.
Well, I'm with you on that, Rex. Rex is describing what we would call some of the generational impacts of mass disaster. In this case, particularly impacting children. Children, for example, have to live with and witness how their parents are responding, and that may not be something that encourages a sense of safety and security in them. And if they carry that into their adult life, they will pass that on to their children also. The other thing that we are noticing, it's the division that's created between the remote workers and the few workers that remained in the workplace, and some assumptions of each of those groups about the other that created resentment and misunderstanding and distrust. So when they began to work more closely together, some called off a furlough, some called back to the workplace from remote work, they realized that relationships among those two groups had moved on, and they weren't even talking conversationally about the same things anymore. And they felt alienated from one another. And I had to get involved in one serious situation with a workforce in mutiny that had come back to the workplace because they were pointing fingers and accusing each other of outrageous things that absolutely weren't true. So there's also that EQ, that emotional intelligence involved in communicating with your workforce if it's divided while they're divided, and in bringing them back to work. It's going to be a process, not an event, when they re-enter the workplace.
Well, it sounds like we certainly have some very challenging times ahead of us, and the work that you guys are doing is extremely important in trying to alleviate some of those risks. The book that you guys have done, how can people get a copy of that book?
Well, Bob, we'll provide a link for you to get a copy, and there'll be three forms of it. There'll be a free summary version. There'll be a hard copy or a printed copy version. There'll be a digital version as well. And the pricing will be on the website for it, but your audience is going to get a discount, so we'll provide a discount code. And all that information we'll provide you so you can provide a link to that. It's a living document. So if you get the digital version, it'll be updated, and you'll get, we're already in version 2, so you'll get version 3 when it gets updated, because we're having more content and experts add to it, and we're learning new things as we go as well.
Well, gentlemen, thank you very much. This has been a fascinating conversation, and it sounds like we have some big challenges ahead of us. So I really appreciate you taking the time and having this conversation and sharing your thoughts and ideas and some of the things that we can do to alleviate some of the stress in the workplace. Thank you very much.
Yep, you're welcome, Bob. Thanks.
Thank you, Bob.
I'll look forward to continuing the conversation. Thanks.
You bet.
You bet. Bye for now.